we share our knowledge and experiences. We share our K-quarantine with the world. Paraguay is bordered by several countries. The risk of spread of infectious diseases is just as high as the number of people who constantly travel by land. This is why the risk has not subsided despite the strong containment and closure policies implemented after the first confirmed case of COVID-19 in March 2020. Lack of professional manpower to meet the demand for epidemiological investigations and regional disparities in access to healthcare also contributed to the problems. Accordingly, the Paraguayan government decided to establish mid- and long-term plans to strengthen its capacity to respond to infectious diseases and applied for KSP Policy Advisory Project support to South Korea. The purpose of this project is to establish policies for effective and systematic emergency responses to infectious disease outbreaks and public health by strengthening Paraguay's healthcare system. To this end, Yonsei University Global Health Center, a project-performing organization, conducted a local situation assessment working together with the Asuncion branch office and through communication with the authorities. The Korean Infectious Disease Outbreak Response System in relation to the Korea Disease Control and Prevention Agency, the process of detection and response to infectious disease outbreaks using ICT, and the response manual were shared. A basic plan for strengthening the infectious disease outbreak response system for systematic control measures for infectious diseases and response to novel and infectious disease outbreaks was developed. The functions of the National Institute of Health, Paraguay, was strengthened, and the national capacity to respond to infectious disease outbreaks was improved by building the capacity of policymakers. Based on this, using K-quarantine know-how, policy recommendations tailored to Paraguay have been completed. The first proposal to Paraguay is the development of a master plan for systematic control measures for infectious diseases and response to infectious disease outbreaks in Paraguay. First, Test, Trace, Treat, Response System. The first button to control infectious diseases is to find confirmed cases through rapid tests. Among the three diagnostic tests, the antigen testing has the disadvantage that it does not help determine past and initial infections, but the time to obtain the results is much shorter than other types of tests. It can also detect an active infection. Therefore, antigen tests appear appropriate in high-prevalence incidence situations. Trace is education and training for epidemiological investigators. Control measures for infectious diseases and policies to prevent recurrence can be proposed based on information gathered by epidemiological investigators in practice, beyond the task of stopping the spread of infectious diseases. South Korea has been implementing the Field Epidemiology Training Program and providing the COVID-19 infection prevention and control response training through online learning resources such as educational videos to designated managers of facilities that are multi-use, multi-purpose, and have multiple functions. Treat. Development of a resource management master plan is a way to respond to a shortage of healthcare resources in the event of a large-scale disease outbreak. South Korea established and opened residential treatment centers and modular, negative pressure isolation rooms to prevent the spread of COVID-19 in its early stage. Since then, from intensive care unit beds to self-isolation treatment at home, different types of treatments have been provided by classifying the severity of illness into 8 levels. Also, resources can be shared from different regions through the bed allocation system by using ICT. Non-pharmaceutical intervention, NPI, which refers to any type of health intervention without medication, is a strategy that must be strengthened in a difficult situation where complete herd immunity cannot be achieved via vaccination due to the emergence of vaccine-resistant mutations, etc. Among non-pharmacological interventions that aim to prevent and/or control the spread of infectious diseases through physical methods, the most used worldwide in 2020 are limiting the size of gatherings, closing shops, and stay-at-home measures. Such measures will prevent the large-scale spread if implemented consistently as the high-intensity policy options, but negative social impacts may occur, and public compliance with such policy may be lowered. Therefore, when setting policies, flexibility is required, according to changes in the prevalence COVID-19 and rate of mutation. The goal of risk communication is to protect the public, stakeholders, and organizations by preventing the spread of diseases and minimizing social disruption. Risk communication should be carried out according to the 5 principles of trust, promptness, transparency, empathy, and accuracy. In Korea, a crisis communication officer of the Korea Disease Control and Prevention Agency communicates a crisis for each alert level in accordance with the standard operating procedures for public health risk communication. ICT is one of the factors that strengthen our capacities to prevent, detect, and respond to health crises. This is because ICT makes it possible to link information between systems across all areas and open public information data in response to COVID-19. It also increases accuracy, speed, accessibility, and utilization. The Smart Quarantine Information System using ICT can prevent and the inflow and spread of infectious diseases from overseas by identifying travelers visiting from affected countries and sharing information on overseas travel records between medical institutions. Medical institutions can also provide appropriate exit screening or entry screening and treatment for inbound travelers from affected areas based on their health status and overseas travel records upon entry. South Korea was recognized by officials and experts worldwide for its best practices in preventing the spread of COVID-19 by tracking the movement of confirmed patients using GPS and managing confirmed cases and people who received self-isolation orders. The introduction of ICT into border crossing procedures in Paraguay was recommended. The COVID-19 Epidemiological Investigation Support System using ICT is a system that can automate the epidemiological investigation procedures only for confirmed patients. When KCDC or local governments request contract tracing information from the support system, it is possible to check related information on the map within the platform using private and public data. In this way, the time has been shortened and the accuracy has been improved compared to the traditional methods such as interviews and handwritten reports documentation. With regard to self-quarantine isolation management, a monitoring system using an ICT-based app was introduced in response to the increase in confirmed cases and the need for data management. The Self-Quarantine Safety Protection app has register, self-diagnosis, and local information-based notification functions. Additional features include information on safety rules and emergency contact numbers. In order to combat infectious diseases, a vaccine delivery system and supply guidelines, which are important means of building herd immunity, must be established. Amid global vaccine shortage, South Korea government urged all individuals to receive the vaccine by determining and classifying priority population groups for vaccination according to the WHO's recommendations. Currently, more than 80% of the entire population has been vaccinated. In Paraguay, as of December 2021, the vaccination completion rate was 38.8%. It has been confirmed that the vaccination has been focused on the vulnerable groups to lower the risk and fatality rate. A safe vaccination distribution and storage system is essential for the COVID-19 vaccines until they are administered. Most vaccines are distributed through the cold chain. With the establishment of an IoT-based integrated control center in Korea, real-time supply chain and distribution management, such as maintenance of temperature of each vaccine shipment and delivery location tracking, is possible throughout the entire vaccine delivery and storage process. In particular, this is an area where the achievement of the Public-Private Partnership (PPP) has been high. An existing warehouse was renovated to secure a cold storage logistics center, and military personnel was participated in transporting vaccines. The second proposal of this project is to strengthen the function and capacity of the Paraguayan National Institute of Health. We identified a number of issues in the course of responding to COVID-19. They include a lack of monitoring, surveillance systems, and laboratories, lack of response capacity, limited access to medicines and vaccines, low knowledge of infectious diseases, and behavioral habits. Realizing the need to strengthen the national capacity to respond to infectious disease outbreaks and health functions due to the COVID-19 pandemic, Korea has expanded its response capacity by upgrading the Korea Centers for Disease Control and Prevention to Korea Disease Control and Prevention Agency and Center for Infectious Disease Research, Korea National Institute of Health to the National Institute of Infectious Diseases. Based on this, we proposed this project to strengthen the functions of the Paraguayan National Institute of Health. This project aims to fulfill roles of the Paraguayan National Institute of Health as a central institution that protects the public from various health risk factors, including infectious diseases. The goals of this project is to strengthen competence in health sciences, develop and enhance competencies of human resources, develop and enhance scientific research, and contribute to improvement of operational capabilities in service and healthcare quality. In particular, for strengthening the functions of the National Institutes of Health, the proposal for organizational improvement by making 6 new departments was made. The training of professional manpower, one of the main tasks of the National Institutes of Health, focused on the training of epidemiological investigators. The effectiveness of training has been enhanced through standardized epidemiological investigation capacity-enhancing training conducted nationwide with uniformity at the central government level. Also, while strengthening the professionalism of manpower, the stability in supply and demand was ensured by linking training with career management. Considering the contents of the local situation assessment and investigations of local conditions in Paraguay, the future project directions of the National Institute of Health after COVID-19 should focus on strengthening regular management and prevention of major infectious diseases, responding to infectious diseases through the One Health approach, strengthening the chronic disease prevention system, and strengthening the response to future health hazards. To this end, this project we proposed the reduction of incidence and fatality rates through expansion of epidemiological investigations, building an integrated multi-ministerial response system under the One Health concept that the health of humans, animals, and the environment are all interconnected, overcoming regional disparities in access to health, and strengthening communication with residents through local public health centers, strengthening communication with residents through local public health centers, and laying the foundation for early detection and preparation for health risk factors such as infectious diseases. This project has contributed to the establishment of successful COVID-19 response policies and vaccine policies by conducting capacity-building training for policymakers at the National Institute of Health in Paraguay on novel infectious diseases. The online invitational training maximized the effect of transfer of knowledge and experience by examining the demand for lecture topics from public officials at the National Institute of Health and organizing lectures according to the requested topics. With regard to the action plan, the National Institute of Health, Paraguay, took the lead and announced a specific action plan for future response to infectious diseases. This is meaningful in that policymakers developed their own action plans after receiving experience sharing and competency training. During the discussion session, we were able to confirm the expected actions of Paraguayan officials, such as establishment of CDC, Centers for Disease Control and Prevention, strengthening communication between central and local governments, and building infectious disease DB infrastructure. The project of the development of a national plan for improving Paraguay's capacity to respond to an infectious disease outbreak was carried out from a mid to long-term perspective. Issues in the Paraguayan infectious disease response system are as follows. Lack of understanding of policy concepts for the management of zoonoses, zoonotic diseases. Lack of human resources to respond to infectious diseases. Absence of a policy to respond to infectious diseases systematically, and a lack of related finance. Lack of health service infrastructure and professional training programs. Inadequate laboratory diagnostic capacity and system for responding to infectious diseases, and a lack of functions of research institutes. Based on such diagnosis and analysis, this project has developed a master plan for strengthening emergency responses to infectious disease outbreaks for systematic control and response to infectious diseases by presenting 6 response strategies based on experiences of South Korea. We have made proposals for the Paraguayan government to establish policies related to public health and response to infectious diseases through the reorganization of the National Institutes of Health and planning manpower training. We have also proposed the directions for effective healthcare systems. We have provided a driving force for continuous change by building the capacity of human resources to respond to infectious diseases. Give up precious daily life because of an infectious disease? Never. Strengthening Paraguay's capacity to respond to an infectious disease outbreak will bring a new start to Paraguayan people's daily lives.